Okay, today I'm going to talk through how to do a breast and axillary exam that we'll be doing on a mannequin. So first, if I was doing this assessment in real life, I would ask the patient if they would like a chaperone present and make sure that I documented whether there was a chaperone present and that I asked if they decline. So I would start with the patient sitting, and we always start with inspection. So I'm going to inspect the bilateral breast tissue, checking for that bilateralness, noting that any small changes are normal. And then I'm going to look at the overall size and shape of the breast. I am going to look at the nipple and make sure and check laterality and size and shape with that as well. Note for any drainage at that site. And then I'm going to look at the vascular network. I want to make sure that is bilateral on both sides, noting that this is normal in pregnancy, increased vascular changes, but making sure that it's bilateral because unilaterally could mean a cancerous process. Then we are going to look for the presence of bulging, dimpling, edema, and that orange peel skin, which also could mean inflammatory processes that we would want to be checking for as well. And then I would look at the axillary and clavicular areas and look at those lymph nodes for any enlargement as well. So then I would screen for retraction. So this would be having using a good light source. I would have them lift their arms above their head, noting any retraction there, putting their hands on their hips, and flexing those pectoral muscles, and then leaning forward as well to remove that breast tissue from the abdomen area, if it's so you can check that area as well. So that would be looking for any retraction, and then I would palpate the breast, having that patient continue to sit in that seated position. So I'm going to palpate starting medial to lateral. I'm going to start at the clavicular area, working down to that inframammary line. So I would work small concentric circles, and then doing that in the vertical strip pattern as well. So we're going to do that all the way to our post-axillary line. Hey. Sorry. Okay. And then I would make sure that I'm palpating the nipple area and then also into the tail of Spence. Then I'm going to palpate the lymph nodes. So palpation of the lymph nodes, you want to make sure you get the pectoral, the central, the lateral up into the arm, the subscapular, and then the supraclav and supraclavicular and infraclavicular areas as well. That would be my assessment.